Hello everyone. Today I'd like to talk about facial rashes and what you can be doing if you find yourself in the unfortunate situation where you have a rash on the face. What I find is that the vast majority of patients who walk into my office have one of a handful of diagnoses when they're dealing with a rash on the face. Either they have acne, and they may or may not be aware of the fact that what they have is acne. Rosacea, perioral dermatitis, also known as periorificial dermatitis, seborrhea or seborrheic dermatitis, eczema, or they happen to be reacting to a product that was applied, either because they are allergic to it or because that product is too strong and it's causing irritation. But basically, this handful of rashes pretty much comprise the majority of facial eruptions that I see in my office. There are certainly many others that cross my mind and need to be considered. But chances are, if you're walking into my office, there's a good chance that you're going to have one of these. And so what helps me distinguish between all of those individual rashes many times is the patient's history, what they tell me. So if they happen to have bumps or pimples and those pimples are tender, in my mind they could have acne or rosacea. If acne or rosacea, both of those can have pimples. If they tell me that they are experiencing redness or episodes of flushing, and if they say that in particular they experience this flushing after they exercise or after they're out in the sun, then I think about, well, maybe this is more like rosacea. If what they describe are tiny little pimples around the mouth or around the nose or around the eyes that are itchy, sometimes tender, but they frequently will say something like, but I've tried popping these and you can't pop them, they're tiny, they're mini. Well, then I'm thinking more along the lines of perioral or periorificial dermatitis. If they tell me, oh, I feel like my skin is scaly and flaking, or I have dry skin that no matter how much I moisturize, it doesn't go away, and it happens to be on the eyebrows or on the central face, and sometimes even along the jawline, along the hairline, I'm thinking about seborrhea or seborrheic dermatitis. If the patient has a lot of itching, intense itching on the face, and in particular if they happen to have had a diagnosis of eczema in the past when they were children, or they have a history of seasonal allergies or food allergies or asthma, I think this is just their eczema manifesting on their face. And if they don't have that history, but they've been applying products on their face, who doesn't, right? We all do. And the rash happens to be itchy, especially if it's localized to just around the mouth or just around the eyes. I start to think, well, maybe this is more allergic in nature to something that's being applied, something that the patient is coming into contact with. And finally, if they tell me, well, this is burning, and if I put this on, it burns. Sometimes it's strange, but sometimes people think they put something on, it burns, and that means that it's getting better. Not necessarily. If something is being applied and it burns, well, that's more of an irritant, and that in and of itself will cause a rash on the face. So as you can see, there's many different potential diagnoses to a rash on the face, and this is just a very short list. This is the short list. This is my short list, and certainly the long list is much longer. But the vast majority of patients that I see, I'm probably going to consider one of these conditions first. And then comes, evaluating the rash. What does it look like? Where is it? You know, are pimples present? That would be acne, or more consistent with acne or rosacea. If there happens to be blackheads and whiteheads, it's slam dunk. It's acne. Rosacea does not have whiteheads or blackheads. If the patient tells me that they've been applying a new eyeshadow on their eyelids, and ever since then they started noticing this rash, well, to me that's a slam dunk. It's an allergy to the new eyeshadow that they've started. So it all depends on how the individual is presenting, and what the patient tells me makes a huge difference in terms of how I'm going to treat it. The bottom line for all of these rashes, regardless of which one you pick, whether they make the short list or the long list, the longer you wait to get them treated, the longer it'll probably take me to actually treat it. Because if it happens to be primarily inflammatory in nature, I have to reverse that ongoing inflammation. And inflammation has this characteristic that the longer it brews, the more that it's going to take to actually reverse it. So the sooner you present, the better. In terms of what can you do, as a dermatologist, I like to see rashes in their original state. Anytime that I see them, once they've been partially treated or suboptimally treated, I have to take that into consideration, and it adds a level of challenge to me, to my diagnostic skills. That's a position that I find myself in all the time. But I prefer to see rashes in their original state, because more often than not, I'm able to make the diagnosis. So frequently what I will tell patients is that I want them, when we want to be minimalists about it, and we don't want to actively treat or over-treat, and we want to, we have a little bit of time on our side, and we want to approach it in a very systematic manner. Many times what I'll say is, I'll just say, stop everything, don't put anything on. Because frequently, regardless of what rash we are talking about, what we're gonna see is that the rash, if we choose the wrong treatment, it could very well get worse. The last thing you want to do is you don't want to see rosacea with superimposed irritant contact type eruption or rash, or you don't want to see rosacea with like an allergy. You know, you want to see things in their original state. You don't want to complicate things. So I frequently will say to patients, stop everything. Stop the sunscreen, stop the moisturizer, stop the toners, the hair removal agents, stop the anti-aging, the corrective spot treatments, the bleaching creams, the exfoliating creams, no masks, no facials, no microdermabrasions, nothing. Stop everything. And people will frequently say, well, what am I supposed to wash my face with? What am I supposed to use for a moisturizer? What can I use for makeup, because I can't go to work tomorrow looking like this? And I will always say, without mentioning any particular line or products, I will always say, well, look for something that is hypoallergenic, because that's not going to hurt the skin, and non-comedonal or non-comedogenic, because that means that it's not going to cause acne. Those are very desirable labels for a product to have. So if you happen to have a rash, you want to be using products that are, you want to stop everything, because anything could potentially be a culprit, or things can get complicated, and you might have one condition and then you develop a secondary condition, and then things really can be challenging. So you want to back off, stop everything, and really stick to fragrance-free, hypoallergenic, non-comedonal, or non-comedogenic products. Whether you're talking about, if you feel like you need a moisturizer, we'll choose one that has those labels. If you feel like you need a wash, again, choose one that that has that on its label. And then last but not least, it would be nice if, there was no makeup applied, but if you absolutely feel like you have to put something on because you couldn't possibly go to work or school or wherever tomorrow with this rash on your face, and trust me when I tell you that I've been there, so I understand, you most definitely want to choose a product, a foundation that is hypoallergenic, non-comedonal. And you want to give yourself just a brief moment, short time frame, 1 to 2 weeks. You may even want to pick up the phone, call, and schedule an appointment while you're giving yourself a trial off of these products. And if, that way you already have that appointment, so that after 2 weeks go by, if you're not doing better, or even if you are better, but it's not completely resolved, you have your appointment where you can show up to the office and get appropriately treated. Because bottom line is, in these kinds of situations, less is more. If you find yourself in the frustrating situation where you have a rash on the face, I see this on a daily basis. All dermatologists do. I highly, highly recommend that you seek an evaluation by a board-certified dermatologist as soon as you can, because that you will more likely experience resolution if you get evaluated and appropriately treated. From the Alamo City, this is Dr. Ana Sauceda, helping you put your best face forward. Take care and have a good evening.